Good afternoon, everybody. Happy Friday. Scott Mabor out on the beach. Beautiful afternoon, actually, or morning, whatever it is. Hope you all had a great week and enjoy the weekend. Just wanted to mention, I have actually 3 clients right now for 3 different reasons. All need to change plans outside of open enrollment. So typically the answer is no, you can't do it. Open enrollment ended December 7th. And you're stuck now until next January 1st. But that's not always the case, and there are workarounds. So the first gentleman had signed up for an advantage plan. Great plan. Back when he signed up for it, was attracted to the premiums and the extra benefits. However, in the interim, he's been diagnosed with stage 4 cancer. So I spoke to him last week. I'm going to talk to him again today. And I said, you know, if your co-pays for procedures and whatnot that they're going to have to do to you are going to exceed $2,400, you're better off on the supplement. So this afternoon, for a March 1st deadline, we're going to switch him over to a supplement. He's able to do that, even though it's outside of open enrollment, because he has an Advantage plan, which has an open enrollment, a different open enrollment period, or an additional open enrollment period that goes until the end of March. So he's able to switch this week or this month for a March 1st effective date. So if somebody has an Advantage plan, they want to go to original Medicare with a supplement, or they want to just switch Advantage plans, not a problem. You can do it until the end of March, and if you do it next week, it'll be effective April 1st. So that was one. Another client was referred to me, spoke to her for the first time yesterday. She had signed herself up for a supplement core plan in Massachusetts and a drug plan. She's not happy with the supplement. It's costing her quite a bit of money, actually. She found an expensive supplement. She told me she just kind of threw a dart at the board and picked a carrier she had heard of. So I won't name the carrier, but it's a very expensive supplement. And it's the core supplement, so it's not even the really good one. In Massachusetts, we only have the 2. So it's the lesser of the 2, and she's paying almost as much as she could be paying. For $10 more a month, she could have the great supplement. So in her case, and she's not thrilled with her drug plan either, but in her case, what I told her is, well, you're kind of stuck. However, if you qualify for prescription Advantage, because she won't qualify for Mass Health, she has too many assets, but I said if you qualify for prescription Advantage, her only income is basically a part-time job and Social Security. If you qualify for prescription Advantage, you get an extra enrollment period anytime you want to use it. So I said, if you want to switch to an Advantage plan, here's the application. I emailed her the PDF as well as the link to the government's website. Get yourself enrolled in prescription Advantage. There's no cost, assuming you meet their eligibility requirements. And now you can switch plans once a year, or one extra time per year. So she can switch. The other option is there is one carrier in Massachusetts. Unfortunately for her, her doctor doesn't take it. But one carrier has 5-star rating in the state. They're merging with another carrier, so I don't know how that will be impacted. But for as long as they have the 5-star rating, they have an open enrollment period, or effectively no enrollment period. You can always switch to that carrier from no matter what you have. However, you have to make sure your doctor's in that plan, and they have a smallish network. But they are the only 5-star option in the state of Massachusetts. Other states have other 5-star options. So if you're in another state and you're watching this, we could certainly check. The last person, also a prescription Advantage. She's not happy with the drug plan. She's having some trouble on a new medication. I think it got resolved, honestly, but I said in the interim, let's get you approved for prescription Advantage. One, it will reduce the copay she has. It's a very expensive medication, and it's a tier 3 or tier 4 on the plan she's on. 2, if there really is a better plan for her, now that she has this new med, if she gets the prescription Advantage, she'll be able to switch plans. And that way, not only will prescription Advantage simply cap how much she'll have to pay, but if she really wants to switch plans, she'll be able to. So there are ways around it, but you are kind of stuck in many cases. But give me a call. If you're stuck, you're not happy with your plan, if you have an Advantage plan, you have till the end of March. If you have a supplement, there's no open enrollment. It's the drug plans that mess you up. And but there are ways around it. So we can always have that conversation and see. Let me know if I can help. There's no charge for any for working with me. I'm happy to answer any questions. Email, text me, phone, whatever. Talk to you soon. Have a great weekend, everyone. Be well.